everyone, and good afternoon. We're giving folks a moment to enter the Zoom room. We'll get started in just a moment. Please note we're recording this session, and we will share the recording following the event. Thanks for joining.
Well, hello and good afternoon, everyone. Thank you so much for joining us. My name is Ruck Buttle. I'm proud to serve as founder of Public-Private Strategies and president of the Public-Private Strategies Institute. We are so thrilled to bring together an amazing event today of accomplished leaders from government, from philanthropy, from the private sector, small business owners, to have a conversation that really is at the core of our nation's recovery, which is really figuring out the important role that small employers create in job quality and job creation, and how do we create good jobs for both small employers and the people who work for them. And today we have collected an amazing set of leaders who get up every morning, who are thinking about these issues to make sure that as we continue our economic recovery, that we build back in a way that makes sense for these critical constituencies. It's my pleasure today to tell you a little bit about what we hope to accomplish over the next hour and a half, and also welcome some of our special guests. Before I do that, I wanted to tell you all a little bit about our Reimagine Main Street initiative. Over 2.5 years ago, when COVID broke out, and quite frankly, no one across the world really understood exactly what that meant. There were a lot of questions about what it meant for all of us. In particular, our team was primarily focused on what this meant for small businesses and small employers across our country. We know what important role they play in our nation's economy, and quite frankly, the important role that they play in community. We gathered a call of over, at that time, 60 organizations from a wide variety of institutions, corporate and philanthropic, small business advocacy organizations, several of the chambers of commerce, to have a conversation. And what was born on that day was an amazing collection of groups who've been truly committed to making sure that small businesses, their communities, the people who work for them, not only recover from COVID-19, but recover in a more equitable way and truly create an economy that makes sense for small employers and the people who work for them. Today's conversation is being hosted by the Reimagine Main Street Initiative, and we are so thankful to be able to do that in partnership with two key groups who've been real leaders in this space as well. We'd like to take this opportunity to recognize the WorkRise Collaborative, which is hosted at the Urban Institute. You're going to hear from their executive director today. They've been an amazing partner in pulling together today's event. We also want to thank Common Future and their leader, Rodney Foxworth, for partnering with us on a survey that you're going to hear more about on the conversation today. And not only a survey of small employers, but one that breaks data down by race and ethnicity so that we can have a firm understanding of what's going on in community. So that as we create solutions, whether they be on the private sector side or on the market sector side, that they're really focused on helping all communities really continue to grow back. So what do we hope to accomplish today? First, we're going to hear opening remarks from a special guest from the Department of Commerce, a fireside chat. As I mentioned, we're going to hear highlights from the survey that we released, which will be available today on reimaginemainstreet.org. We're going to hear from small business owners directly, and we're also going to hear from several of our nation's leading experts in philanthropy, at nonprofit institutions and think tanks across the country. And of course, we'll have some closing remarks. We encourage you to be active in today's conversation. If you have comments that you want to put in the chat, of course, the speakers and the host will see those comments, and we will do our best to respond to them as we're facilitating conversation with today's expert. So let's go ahead and get started. We are so pleased today to be able to be joined by someone who I've actually had the privilege of calling a colleague for maybe way too long. But we're so excited to be able to welcome Michelle Chang, who serves as Deputy Assistant Secretary at the Economic Development Administration in the U.S. Department of Commerce. Michelle is amazing for a variety of reasons. One is she is leading a number of amazing initiatives at the Department of Commerce, including the Good Jobs Challenge, which we'll hear a little bit more about. But also, Michelle has been a fierce advocate for the small business community during the Obama administration. Her and I had the pleasure of working together when she was at the U.S. Small Business Administration. And she's even more amazing because she stepped in today very last minute to fill in for the Deputy Secretary who was called away to the White House. And it speaks to her incredible character that she was able to turn around so quickly to be able to join us. I like to say Michelle is so popular. To get time on her calendar, you have to request time from the Deputy Secretary just to get a little bit of Michelle's time. So with that, we are thrilled to be able to turn the conversation over to Michelle for some opening remarks before we move into a fireside chat. So Michelle, over to you, and thank you so much for being with us today.
Thanks so much for that warm welcome, Rhett. And if that was true, I would definitely, that would be definitely funny if that was true. You had to go to the deputy secretary to come to me. But I am so happy to be with you all today. When the folks reached out to me to come speak to this group, obviously it's a group that I feel very passionate about. Like Rhett mentioned, I spent a lot of my career focused on small businesses and also job quality. Those are two topics that are just very near and dear to my heart. So very excited to talk to you all about that today. To get us started, I was just going to start with a few opening remarks to get you all familiar with the Economic Development Administration and talk a little bit of our priorities there for those of you who may not be familiar. So for starters, just to level set, the Economic Development Administration is a bureau within the Department of Commerce, and our mission is to lead the federal economic development agenda. We focus on promoting innovation and competitiveness and preparing America's regions for growth and success in the worldwide economy. We are the only entity that is solely focused on economic development in the federal government. We do this by focusing on three major things. We are trying to increase America's global economic competitiveness, supporting community-led economic development, and helping communities develop resilient and agile local economies, which we know is so incredibly important given the last few years and the pandemic that we have all been living through. We at the Economic Development Administration are at a really exciting moment right now. We received $3 billion in the American Rescue Plan Act. That is 10 times our normal annual budget. And so it's been a really historic moment for us to rethink how we are going to invest in America's communities. What we ended up doing was develop 6 different notice of funding opportunities or 6 different grants to be able to really support bottom-up economic development while also focusing on advancing equity, creating good paying jobs, and helping workers get the skills that they need to be able to land those good quality jobs. We are also focused on building economic resiliency as well as accelerating the recovery for industries and communities most hard hit by the pandemic. When we looked at the different programs that we were going to develop with this $3 billion, we focused on creating jobs for today, communities built for all, and regions for the future. The 6 different programs that we have, you can take a look at all 6 of them on our website, eda.gov/ARPA. That stands for American Rescue Plan Act, but I want to focus on 2 of those programs for you all. The first is the Build Back Better Regional Challenge. This is a $1 billion grant program that really is a transformative program that helped us really rethink how we do economic development investment as a bureau. We never got, like I mentioned, this amount of funding before. And so it really allowed us to really think how we'd like to use a more significant amount of money to invest in communities across our country. What we ended up doing was develop a grant program that had 2 phases. What we are trying to do with this grant program is to invest in regional industry clusters in areas and industries that are growing or emerging, and really put a significant amount of money into those regions to help them be able to jumpstart these communities as well as the industries and the supporting type of infrastructure needed to help those industries grow. So we put an open call to the entire country. The unique thing about the American Rescue Plan Act was it also allowed us to open up our grant programs to every community in our country because every community experienced some level of distress from the pandemic. And so with that, we asked for folks to give us their most forward-thinking, groundbreaking ideas of how they could really reimagine their communities and the industries in their regions. We received 529 applications, and of those, we selected 60 finalists to then move on to our final phase. We currently have received applications from all 60 finalists, and we will be ultimately announcing the awardees of that program in the coming weeks. The second program I want to highlight, Rhett mentioned, was the Good Jobs Challenge. This is EDA's first 100% solely focused workforce development program. This is a program that's focused on helping Americans get back into good quality jobs by investing in regional workforce training systems that will train workers with the in-demand skills needed through sectoral partnerships. And so one of the key things that we really focused on with this program was to really invest and fund employer-driven training programs. Our secretary often says that she does not want to invest in what she calls train and pray programs where you train workers and you pray that they will get into a good quality job. That's exactly what we're not trying to fund here. What we are trying to fund here is training folks for jobs that are real, they are open and they are vacant, and that we can place folks into good quality jobs. And so one of the key things we looked at with this program was to look for employer commitments to hire. And so as we did outreach to a number of different stakeholders and communities for this program, that's one of the key things that we really stressed was employer leadership, employer engagement, and employer commitment. As many of you know, no workforce program is successful without true partnerships. And so what we also looked for is an integrated public, private, and community-focused approach to doing outreach to underserved populations and communities, really ensuring that there's high quality training, as well as the wraparound services to support workers as they're going through training. Particularly for underserved communities, we know that that's extremely important. And so that's some of the things that we are really looking at is, as we're looking at the applications, is to make sure that as these proposals are focused on different underserved populations and communities, they are being also very mindful of the type of support those populations may need. The other thing that we really looked at is intentional connection between workforce and economic development. As many of you know, there has been an increasing recognition that economic development cannot happen without true workforce development, and hence why we've been so focused on workforce development at EDA. And so we really are looking for the connection between workforce and economic development. Now, I know you all are here today to talk a lot about job quality in the context of small businesses. And so that's an extremely important topic, and would love to just comment a little bit about that before I hand this back. Job quality is something that we really focused on, particularly with the Good Jobs Challenge. We wanted to not just train workers for any job, but for a quality job. And we've been working very closely with our colleagues at the Department of Labor, as well as folks at the Domestic Policy Council and the National Economic Council as well, to really think about what it means to be a quality job. Obviously, there's a lot of definitions out there. For the sake of our Good Jobs Challenge, we broke it down to 3 major things that we felt like a good quality job must have. The first was around wages. We looked for jobs that had a decent wages. And so we defined that as exceeding the local prevailing wage for the industry in that particular region. The second component was benefits. We wanted jobs that had at least basic benefits, paid leave, health insurance, retirement savings plan, and/or is a unionized job. And then the third component we looked at in terms of job quality was a job that would help the employee develop the skills and experiences necessary to advance along a career pathway for career mobility. So we wanted to put that out there, and I certainly can appreciate that being a small business it can be a little more challenging than having for employers than it could be for a large company. I'll just tell a quick story. Prior to coming into this role, I worked with a lot of large companies and helped them really think about how to fill the needs that they needed from a workforce perspective. And the reason that we worked with large companies was not really by having to. It was a decision that we made really intentionally. And the reason was that oftentimes we know that small business owners are juggling a lot of things. Oftentimes the CEO is also the head of HR, the head of finance, the head of operations. It's a lot of hats to wear. And so when we were working with employers in my previous job, we were really thinking about how could we move employers to think more about how they could fill their workforce needs with a more diverse set of folks. And so the reason we targeted large employers to pilot a lot of this work is we know that they have a little bit more resources, bigger HR departments to be able to try to demonstrate that this approach was going to be successful. And so we worked with a lot of large employers to test out different practices like skills-based hiring, partnerships with local community colleges, creating workforce development systems and programs to fill their needs. And the thing that I found that was really interesting was that a lot of these companies, the large companies, once they were able to get something up and running, what they did was be able to expand their programs to the small businesses in their communities, which oftentimes were their suppliers or their customers. And so there was a definite incentive to make those folks successful as well. And so I guess I say all of this to encourage you all as small business owners or folks that work with small businesses. We know it's difficult sometimes when small businesses have so many different hats to wear, but there are folks out there to collaborate with, to be able to think about different ways to approach your workforce needs and to be able to fill those needs. And so I would strongly encourage you all to work with folks that are in your community that may be connected to some of these different innovative workforce programs that are being developed and seeing how small businesses can become part of that. I have found just that a lot of people are really open to expanding and scaling to help small businesses also benefit from a lot of these programs. So with that, I will turn this back to Rhett, and I think we're gonna do a little chat here.
Yes, this is the point where if we were live, we would invite Todd to like do his walk across the stage. But Todd, will invite you to turn on your camera. And it's my pleasure to invite into the conversation Todd Green, who's not only a fellow at the Urban Institute, but is the executive director of the WorkRise program. And Todd has an amazing history working not only with HBCUs and the work that he's done in Atlanta, but also at the Federal Reserve in Atlanta. And we're so thrilled to be able to have him in this post and as part of the conversation. And as Todd gets situated, Michelle, I wanted to sort of continue on one of the themes that you were talking about, which is the number of programs that you all are sort of rolling out. And, I'm curious just to get the conversation going, are you guys starting to see early learnings from the program and sort of what successes have you seen from the programs that you've been rolling out, like the Good Jobs Challenge, as it relates to this work?
That's a great question, right? So I think one of the things that we were hoping would happen, and it has really exceeded our expectation, is the collaboration within communities that have happened across sectors. That was some of the things that we tried to stress through our notice of funding opportunities, was the collaboration of educational institutions with employers, with community-based organizations, with unions, all those different folks coming together to be able to really think about the needs of the community in a more cohesive, connected way. And we've just been really pleasantly surprised, even with Build Back Better, which is slightly different, but similar to our assistant secretary actually did a tour of 12 of the different finalists, and many of them said, you know what, regardless of what happens, if we end up getting the grant or not, we have made so many great connections and this work is going to continue. And so that's exactly what this is all about, right? To make connections, make sure that folks within communities are working together, because I think we all have the same goal, and sometimes we may be working at things separately, but together the efforts can just be so much more impactful.
Makes sense. Todd, I want to bring you in. First, I want to give you the opportunity to talk about WorkRise and the incredible work you're doing, because I would just not do it justice. But I know one of the things you all is you're funding a lot of research. And I know that the research is really sort of making the case between, we're going to use the term a lot in this conversation, job quality. I think there's a lot of small employers now, and, the term job quality means a good job, but you're seeing that being linked to this broader conversation around economic mobility. So tell us a little bit about WorkRise. Tell us about sort of the research and other work that you're funding and doing, and what you're learning from that research.
Sure. Well, first of all, I want to say thank you for having me as part of this conversation. It's so exciting and it's so needed. And thank you to the Economic Development Administration. I was just down in Alabama yesterday, and with a group of communities, and they're so very excited about all of the exciting programs and what this is going to mean for the small businesses in places like Dothan, Tuscaloosa, and Tuscumbia. So real people are really impacted by this. So I want to share maybe 3 examples from the research that we do at WorkRise, or that we've been supporting, that really connect these sets of conversations. One is a partnership, Work Equity. It's a partnership that we're supporting with Boston College and SHRM, of course, the Society of Human Resource Management. But this team is fielding a survey of small and medium-sized businesses on their practices related to diversity, equity, and inclusion. So we already know that DEI practices can certainly improve job quality and employee retention and economic security. But what we don't know as much, and what this team is working on, is how can small businesses deploy these practices, and what do they need to really make them successful, and what kinds of supports do they need? Another project that I think really connects this with our WorkRise portfolio is another project that's being fielded out of MIT, out of Sloan and the Harvard Business School, and it's about job design for entry-level workers. So here the researchers hypothesize that there's an opportunity to increase mobility by giving low-wage workers higher levels of tasks to perform. And so what we're wanting to look at is, how does that translate into a small business context? So we're so excited about what some of those questions are. And then maybe finally, the last project that I'll mention, it's about scheduling. And this is a pilot study, and it's with a larger employer, IKEA, but certainly we've already been thinking about what are the lessons that are needed to learn, that we can learn from this. So we already know that scheduling is such a huge part of job quality, and several studies have supported this fact that unpredictable scheduling leads to income volatility, greater stresses for workers and families, and really worse economic outcomes. But what we don't know is how we design this in a way that we can test some of these practices. So and certainly putting them in a small business context. So those are three exciting pieces of research that I think can really influence and impact the conversation that we're having today.
Sense. And Todd, I want to stick with you and talk a little bit about racial equity. And I'm actually going to ask Michelle to pile on after you. But what we saw during COVID in particular was all small businesses get hard, but particularly in communities of color. And I think the research, for a number of years has talked about the important role that small employers play in communities of color in terms of job creation and wealth creation. And so I'm wondering, how do you see this connection between good jobs or jobs quality and racial equity? How is that manifesting in the work you're doing? And then, Michelle, I'd love to hear about that as well in the government context about how you're thinking about it. But Todd, can we start with you and stay on that thread?
Yeah, certainly. You've already mentioned the real importance of supporting these minority businesses. They're beyond these economic engines for their own community. This really is a source for wealth creation. And then a recent study showed that small businesses create that the stimulus checks and other income supports provided by CARES legislation, while it was helpful, there's still this big issue that I think certainly, Rhett, you've known me for a long time, and this is something that we continue to face. And this is this issue of access to capital. So we've got to figure out ways to kind of move beyond that. And I think that we've got to bridge this job quality discussion as an opportunity, but we've got to face maybe this foundational issue that certainly the pandemic highlighted again for us once and again, is this issue of access to capital. So I'll leave it at that for the moment.
Michelle, thoughts from your perch?
Yeah, one of our primary goals and one of our top priorities at the Economic Development Administration is equity. When we came in this administration, one of the first things we did was look at what we call our investment priorities at the Economic Development Administration. These are our guiding principles of the type of projects that we invest in. And we revisit them, and equity's always been important to the Economic Development Administration, but we redoubled our efforts and made it our top priority. And so what that means is that we've made very intentional efforts to make sure that our programs are really stressing the importance of serving underserved populations and communities. And that's everything from the way we write our programs, our notice of funding opportunities, to how we evaluate projects that come in, to the types of folks that we bring in to evaluate our applications that we receive. We're making sure that we're bringing folks from diverse backgrounds, from diverse experiences, to make sure that we are being able to really invest in projects that will help, particularly those with underserved, that are underserved. And then that carries on too, as we actually award these grants to, we're looking at a number of different metrics to measure that impact too. And so it's something that's just extremely important in everything that we do. We've done a lot, I feel like, internally, and now we're actually putting out some more efforts to do things externally. I just do want to highlight, we actually have a new funded notice of funding opportunity that we released earlier, I want to say actually in June. It is a new funding opportunity around equity, where we are really trying to improve the outcomes around equity on two fronts. We want to improve the representation of underserved populations and communities in local economic development. And we also want to help our EDA grantees improve their equity plans and outcomes. So I do urge you all, if you're interested in taking a look at that, the deadline for those applications are August 5th, and you can find information on our website, eda.gov, if you Google equity impact investments.
Right, if I may just go back for a moment, just to build off of this, because I think what we just heard was so important. And I'll also just say, and this is just going back to, you've heard a lot about programming and the equity component, but also there's such an important piece with respect to the research and the research design. So I know that we spend a lot of time on this at WorkRise, and several of others who are part of this conversation today are actually thinking about how do we include those conversations of lived experience to ensure that we are developing the types of programs or the research results are actually going to be representative and reflective of the communities that they are intended to help to seek. So what that means is that these individuals, both small businesses and also those racial minorities, they need to be present as part of the research design, but they also need to be present in terms of how how the research is actually implemented. So that's a huge part, and I know that EDA and WorkRise and others, and many of the partners on this call are very much focused on centering those conversations, but maybe thinking about it a little differently with a higher level of intentionality to ensure that we are supporting those businesses and those stakeholders whose voices need to be heard.
Makes a lot of sense. We are, believe it or not, already over time. So I'm going to pack 2 questions into our final question. We have about 250 people on the line. We had 600 people register. People are going to watch this. I think, we're in some ways building a movement, even just this conversation here with all the different folks. I want to ask you both, though, about gaps, like people who aren't on the train yet, right? Like from your purchase, where do you see the gaps? Where do we need more pressure? Who more do we need involved sort of broadly? And the second piece is, I think the reality is we are in an interesting economic climate. Some people have not recovered fast enough from this pandemic. Some people have done quite well. We see lots of positive signs on the economy around, the job rate numbers being down. But we also know that it's still too hard for working families to get ahead in our country. And so how do we do this important work, which I think is long-term work, when the short-term sort of needs are the things that are nagging at us in our day-to-day decisions? So first, where are the gaps, and sort of how do we do the important work in this context? So Todd, do you want to kick us off, and then we'll invite Michelle to close us out?
Sure, I'll be really brief here. Certainly we see a lot of gaps with even thinking about small business. So much of the research that's done and so many of the programs have been designed to support larger businesses. So I'm so excited about these sets of conversations that are moving in that direction. Additionally, we continue to see disparate outcomes with respect to certain minority populations, tribal populations. So there are opportunities for us to reach those organizations and maybe redouble our efforts and our outreach and engagement with those constituencies. But I'll just speak maybe a bit more positively about this moment. So some people say, are we in a moment, or is this kind of a movement, or how are we thinking about this time where the voices of the stakeholders that we care about on this call are being considered mainly because of a tight labor market and the economy we find ourselves in. So we've got to take advantage of this moment, and we've got to build in durable processes and rules and incentives to ensure that these opportunities can withstand the test of time as we face whatever the next economic cycle might come. So those would be the opportunities I mentioned.
Michelle, take us home.
Yeah, I guess first in terms of gaps, I'd say one of the things that we've really noticed is the real need for technical assistance and capacity building, particularly for underserved populations and communities. I think one of the things that we really realized when we got this $3 billion is that we wanted to get these funds out to regions, to organizations that maybe had never gotten resources or funds from the federal government or from us in particular. And well, we realized that it was sometimes hard for those regions to compete with folks who have gone through the process before and understand this is what makes a winning application. And so what I'd love to see is to be able to level that playing field a little bit and to help these, particularly when you look at it's the communities that need it the most, these underserved populations and communities. We've got to get them to a point where or we could do one of two things, and we debate this a lot internally. Do we help them build the capacity so they can effectively compete with the others, or do we need to change the criteria a little bit to meet folks where they are? And so that's something that I think like we're very conscious of, and we're trying to figure out the right balance. But that's an area that we'd love to see some improvement around.
That makes a ton of sense. Well, Todd, thank you for your amazing partnership on this, Met, and Michelle, thank you for being a partner in the work that you've been doing ongoing, and also stepping in last minute. We appreciate you taking on the task and look forward to working with you both. With that, huge thanks to both of my colleagues. And now, before we hop into the panels, and like I said, we have a great conversation coming for you with folks from philanthropy, additional folks from government. We're going to hear from actual small employers. It's my pleasure to turn the conversation over to my colleague and friend, Tammy Halevi, who's really just been leading an amazing body of work, leading the Reimagine Main Street with our colleague James West, who's also on the line, who you might not see today, but has been the heartbeat of our team, with huge thanks to him. And Tammy has been leading and pioneering this set of research, which really helps us, again, look at solutions in a way that allows us to create policy and market solutions for the population we're serving, which is small business owners and the people who work for them. So Tammy, over to you.
Thank you, Red. As Red said, I'm Tammy Halevi, and on behalf of the team at Reimagine Main Street and our partners, Workrise and Common Future, it is also my great pleasure to welcome you today to the timely, important conversation. As Red mentioned, in a few minutes, you'll hear directly from some amazing small employers and thoughtful experts and advocates. I want to share some top lines from a national survey that we conducted with Common Future and fielded last fall. You are able to access the survey findings on our website, reimaginemainstreet.org, and I will go relatively quickly through our findings. So it is no surprise to anyone who's joined this call that COVID-19 centered attention and elevated the imperatives to address economic mobility and racial equity and the related issue of job quality. You heard perspectives just now from Todd Green and Secretary Chang. You also heard that government agencies and nonprofit organizations with support from philanthropy have responded by developing job quality standards and metrics and support tools and programs. And as you heard Todd Green say, research design matters. We saw a gap in understanding perspectives and unique constraints of diverse small employers, which are especially important because according to Gallup, low-income workers are disproportionately employed by small companies. And so we decided to survey those small employers. Last November, Reimagine Main Street partnered with Common Future to field a national survey. As you can see, this effort yielded just over 1,265 complete responses from small business owners who employ between 1 and 100 people. Our sample included more than 100 API business owners, more than 400 Black, African American, or African business owners, 150 Latino or Latina business owners, more than 50 Native business owners, and more than 450 white business owners. The sample reflects the broad range of small employers. Respondents include businesses with up to 100 employees, as I noted. Every state and the District of Columbia is represented, and a very, very long mix of industries. Before we go into the conversation with our amazing guest lineup of small employers and experts, going to share 5 of the top line findings. And like I said, the full survey results are available on our website. So here's what we found. First, working at a small firm is not inherently bad. Small employers see their primary value proposition as flexibility and trust, both of which are critical intangibles and can be elusive from a job. Second, small employers are frequently in the same financial boat as their workers. In general, when the workers are struggling with their financial health, so is the owner. Third, not surprisingly, business performance is a critical indicator of the financial health of employees. The financial health of workers is better when business performance is strong, and we measured strength by profitability. Business performance, not surprisingly, drives compensation levels, and frankly, tight margins constrain wage growth, and that's especially true for Black and Latino small employers. And finally, on the topic of benefits, which is a critical component, small employers see benefits as worker incentives, but they say offering them is cost prohibitive. Like I said, there's a lot of data beneath all of these messages. you can go to the website to find them. We think these findings are super interesting, important, and actionable, but what is far, far more important is what these findings mean in the real world. And so thankfully, we've assembled an extraordinary group of people to help us make meaning. To get us started, I am delighted to now welcome Amy Saxton, who is Vice President of Program Development at the James Irvine Foundation. Honestly, we could not have asked for a better person to moderate this dialogue with the two incredible small employers you are about to meet. Amy leads strategy for future grant making and works collaboratively across the foundation to oversee the Irvine Foundation's grant portfolio. The James Irvine Foundation is an independent foundation that makes about $180 million in grant making each year, with a sole focus on ensuring that low-wage workers in the state of California have the power to advance economically. Amy, we are thrilled that you have joined us. Welcome, and over to you.
Thank you so much, Tammy. Good afternoon. I'm Amy Saxton. I go by she, her, hers pronouns. I'm honored to serve as your facilitator as we learn from the voices of small employers. I want to welcome to the panel and ask my colleagues to take themselves off of mute and put their videos on. And I just want to extend a very warm thank you to our two small business leaders who are joining us today. Tiara Flynn is Chief Executive Officer of Some New Marketing, and Dr. Erica Gonzalez is CEO and President of the South Texas Allergy and Asthma Medical Professionals, also STAMP. The James Irvine Foundation has been increasing its investments in small business because we see small business as a powerful force for workers earning low wages to advance economically. That can happen as owners or as employees when the employers are offering a good job. I believe that most small businesses want to provide quality jobs to their employees and contribute to their communities, while of course providing a livelihood for the owner and their families. So how and when does that happen? What gets in the way, and what can government and philanthropy do? Our charge is to learn some about that question through the candid stories, and as Todd said earlier, the very important lived experiences of our esteemed panelists. With no further ado, first question. You are each successful small business owners who has created jobs for others in your community. Tiara, can you please tell us about Some New Marketing, your team, and how you came to lead the company?
Thank you so much, Amy, and everyone that facilitated this and created this opportunity for us to have this discussion today. My name is Tiara Flynn. I am the owner and CEO of Some New Marketing. We are a small business marketing firm based in Las Vegas, Nevada. I am actually the second generation owner. My dad founded and started the company in 2006. And at the time I was actually our very first intern. So we are a true family-owned business. My mom is our human resources director. As it was stated earlier, we all wear many different hats. So we've been in ownership together now since 2012 was when I joined the ownership team. We are a veteran-owned. I served in the Air Force for 9 years. My dad served in the Air Force for 10 years. We are minority-owned and now majority woman-owned. So we employ anywhere between pre-COVID and even after COVID. Our team usually consists of 5 to 7 people. And also, as it was stated earlier, we really heavily rely on our collaborations and partnerships with other small businesses to help us, get through as well, and to expand and to be able to take on larger projects. Happy to be here today.
Thank you so much. Dr. Gonzalez, tell us about STAMP, the folks you employ, and how you came to found and lead STAMP.
Yes, thank you, and good afternoon to everyone. So we started our practice in 2014, and we started with one allergy clinic, and up to this point, we had 4 employees. And the first 2 years, it was very much kind of coming in, doing all the jobs, being, somebody was mentioning earlier, you're the marketing person, you're the HR person, and kind of taking on those roles for a good 2 years. We grew pretty rapidly, and currently we now have 3 clinics and 2 research centers, and we employ 35 individuals. So we're happy with the growth. Of course, the pandemic definitely kept us extremely busy. Just as my previous colleague was stating, I'm also minority-owned, veteran-owned business and woman-owned business. So we're proud of that. And yeah, I mean, we're just kind of continuing to take it one day at a time.
I heard many hats, all the hats. It's so good to be in conversation with you both. Tell us, why do you think people work for your businesses? If your team members were here, what would they say keeps them coming to work and staying at your company? Let's start with Dr. Gonzalez.
Yes, so both my parents were entrepreneurs themselves. So growing up, I got to see what that was like. They had very small businesses, never really had more than 2 or 3 employees. But one thing that they really modeled for us was taking care of your employee. If you take care of your employees, they will be loyal to you. And so from day one, in the first couple of years when starting a medical practice, it's not just me as a physician and my husband who helps me run the clinic, kind of, putting in the time, but our front desk and our nurses are also working pretty hard, managing more things than they normally would. So I think that since day one, we've just always been sure to take care of our employees, not let the bottom line, dictate how they're treated or the things that they do. And what we have found is that has created a very loyal environment of employees who, in the times when we do need them to maybe go the extra mile, they're willing to, and not because they feel they have to, not because they think if they don't, they'll lose their jobs, but because they want to. And I think that I think my colleague would agree with this. That's something also that's very much fostered in the military. So, it's something that I think both me and my husband, both being prior military veterans, it was easy for us to kind of take that atmosphere and that type of environment and bring it into our own small business. So I would say that for me, that's been the biggest thing. And I think that our employees would say that they feel that they're very well taken care of.
Tiara, what would your employees say is what keeps them coming to work?
I think they would say it's our integrity. And I think I know a lot of who we are, we say we are, we mean it. And they can really see that in the way that, they're treated, in the way that we engage with them, the way that we're transparent with them all the time. I think that's really huge because no one wants to feel like they can't trust their employers. And so us building that relationship from the very beginning with our team, when we say we're family owned, we're including our team as well. And they always joke with us and say when they were with larger companies or whatever, that the family thing was thrown around, but they were like, we really feel like family here. We don't just know our employees, we know their kids, we know their spouses, we know their grandmother, anybody that is important or close to their life, and the flexibility as well. It allows us to be very flexible with them. And I know that they appreciate that more than anything because we really know them. They're truly our family.
I recall you mentioning, Tiara, when we spoke earlier, that you sometimes had kids of your workers in the office and like a little space for them carved out so they can really use that flexibility.
There are 2 kids next door right now.
Well, we welcome kiddo voices, bring it on. So there was a lot about trust in what you all said. And some have said that small business is like one of the last institutions that people really trust. So tell us a little bit about what it takes to attract and retain workers. You have that trust, perhaps, and that flexibility that I know some other aspects might not compare perhaps to some big businesses. Tiara, how would you describe some of the challenges for some new in retaining workers and hiring new employees? And what have you done about that?
Oh, for sure. So I think the first thing is that, again, going back to honesty, when we interview with people, there's nowhere for us to kind of hide things, being a small business, being such a small team, we can't overpromise and underdeliver because it's all out there. It's right in front of them. I love that the survey results mentioned earlier that we're oftentimes in the same financial state as our employees, which I was looking at it going, sometimes worse. And we're very transparent about, the success of the company means your success, and not just in a financial aspect. I think that's one thing that helps us to bring people in, letting them know, like, we really trust your innovation, we trust your vision. We're not married to any idea or any process or procedure within the office. If you have something that you feel like can help us improve and grow and expand, bring it to us and we'll discuss it. We're just very open and welcoming in that way. As far as being able to find, we also utilize a lot of the workforce programs, a lot of the internship programs here in Nevada, through the University of Nevada, Las Vegas, through College of Southern Nevada. Because of the industry that we're in marketing, in branding, we're very much motivated by the young mind. So we get a lot of younger people and a lot of interns turned into hire, because that was my story. And so we kind of stuck with that, honestly.
Thank you so much, Tiara. And Dr. Gonzalez, especially in the pandemic context, what's it been like to retain and hire staff?
Well, it's definitely been a lot more challenging over the past 2 years. Previously to the pandemic, I think that we struggled with a lot of the same things that other small companies do. So, trying to compete with big corporate companies that are able to offer maybe more benefits. For us, of course, one of the benefits that was very important to us because of what we do was healthcare. So, I think that was one thing that did help us attract people in the beginning, because that was one thing that just because of what we did, we offered from day one. So it wasn't easy. That's probably, I think some of the other surveys that have been done show that that's probably the biggest expense for most employers. So there's definitely room for improvement there. But we have found that, it goes back to what you were asking in your first question. I think that people don't necessarily leave a job just for benefits or money if they feel like they have a place in the organization. And so when someone is coming in, one of the most important things is to make sure they know what their role is and how their role makes a difference, because it gives them a sense of purpose. And when someone has a sense of purpose, they'll be more likely to kind of be happy about waking up in the morning and coming into work. And so we really strive, to kind of make sure that everybody understands how, no matter what we're doing, their role, it plays a big part in our success. And I think that the other thing that helps is that when things got tough, and they got extremely tough during the pandemic, a lot of the younger generation right now, I think of, sometimes just because of the age, and this is all of us at that age, the grass is greener. So they'll go and they'll try to work in another clinic, and they're going to have the same challenges. I mean, the hours we were working, the volume of patients that we were seeing, and also, patients never being happy, right? So it was a very stressful time for so many people. And I know that a lot of frontline workers got the brunt of that stress and that frustration. And so it wasn't any different for us. I mean, we were tired, we were working hard, and then we still had people that, weren't happy. And it was kind of, a hit on your morale. So just making sure that you checked in with them and say, hey, I think you need to take a break, take the next day off, and covering for each other. So knowing that even me as the CEO president, I'm willing to step into the trenches with them. And if I have to, be the one to take the trash out or change the light bulb, that's what I'm going to do. And when they see that, then they understand that all the roles that people play in the company are important.
Let's turn to some of the real core components that people think of, or that I sometimes think of when I'm thinking of a good job. Like, what am I paid? What kind of benefits am I offered? It's amazing to hear, Dr. Gonzalez, that you were able to offer health benefits from day one. That's not the case for every small business, as we saw in the survey results. I would love to start with you, Dr. Gonzalez. What kind of benefits, what additional kinds of benefits do you offer? How do you make choices about what to offer and what not to offer? And how do you think about compensation as well?
I think that one of the most important things for us that helped us out was being involved with the Chamber of Commerce here in San Antonio. So I think that the chambers and a lot of other organizations have so many resources that can help you figure out some of those questions, and not only what benefits can you offer, but how can you offer them, and is there a way to kind of group things together to get better rates on your health care? And now there's a lot of different organizations that are willing to come in and do your HR and offer some good benefit packages. So we're lucky that we're able to offer a 401k, a PTO, sick leave and vacation leave, and that kind of increases as people are here with longer tenure. And then, of course, some life insurance, medical benefits, and dental benefits for our own employees. And then they have the option to add on their family members, which, of course, that in itself is extremely challenging. And when people come in, I think that one of the things that we noticed during the pandemic is that the rates that we thought were fair before were definitely not fair game anymore. And we really had to adjust. We saw, us increasing salaries higher than we were comfortable with, but it needed to be done. Otherwise, you couldn't retain your employees, and it cost us more to have that employee turnover. So kind of just looking to make sure you have a good network of colleagues that you can ask, like, hey, how much are you paying your nurses? Like, try to kind of get a sense of what the community is doing, because some of these bigger corporations, if anybody's familiar with San Antonio in particular, you've got the big USAs and HEBs that they're able to say, we're going to offer you starting $20 an hour or $25 an hour, and we can't compete with that. So even somebody who may have trained to do specifically what we're asking them to do would rather go work for the higher wages.
Thank you for the candor. And it's an amazing wealth of benefits you're able to offer. You mentioned pooling with other organizations to be able to get some better rates, needing to increase compensation, keeping in touch with your network to figure it out. Tiara, I want to welcome just real candor. I know the situation might look a little different for some now.
Yeah, absolutely. We haven't been as fortunate to be able to offer what we view as, the best of the best plans. It's been up and down, to be quite honest, over the last 15 years. I would say that one of the best plans that we offered at one time, we had about 9 people, because most of the group ones work really well. So I think at the time we had about 9 full-time and maybe like 4 part-time, and we went with the group plan. But even in that instance, some knew was covering about 80% of those costs, for them. So that way they didn't have to come out of pocket. And I was honestly, I've been shocked over the years at the rates, as Dr. Gonzalez said, like pre-COVID, and then after COVID, it's like, how did it get worse? Because I think it's important for people to understand, like, those standard plans don't always include things like specialist care or emergency care or preventative care. And so those are things that we want for our employees if they have a pre-existing condition, or even just, dental. That's what I mean by when we start to cover those additional things. Some new, the company, it starts to get very challenging, and we aren't able to compete. Just as Dr. Gonzalez said, they have those huge competitors in Texas. In Vegas, being in marketing, someone might go take a job on the Strip at a major casino in their marketing department. But I think, again, going back to what I was saying earlier, we win them over is because you can go work for the gaming industry or go work for a major international MGM resorts or what have you. And you're not going to really be on the marketing team. So I think we kind of win them over in that aspect of here, we respect your innovation, your input truly. Even our interns are paid interns. They're not running off to get coffee and things like that. They're really a part of the full marketing process. So I think that's where we win them over. And then as well as we have PTO and things like that listed in our handbook, but I can tell you right now, the people that have been with us 5+ years or even shorter periods of time, if they have a death in the family, if someone gets sick, just go. We're not as strict with it, I guess I could say. Like, we're not clocking last time you took this many days and this time, things like that. So I think we win them over in that space as well.
Super helpful. And I recall, well, Tiara, you saying that even when you could offer more generous benefits, there's sometimes just so much overwhelming information about which package to choose, and it's changing all the time. And it sounds like not ever in a direction that's more cost affordable. So let's come to our last question for both of you. What would you ask, or what advice would you give to the federal government, to state governments, to philanthropy? What could they do to make it easier for business owners, particularly business owners of color, to be able to offer workers these strong wages and full benefits that really support good jobs? Dr. Gonzalez, did you want to start? And Tiara, did you want to wrap up?
Absolutely. So, I think for me, I would like to emphasize again that when you look at what the most expensive benefit is for employers, it is healthcare. And there's so much reform that needs to happen, not only in healthcare, but in pharmaceuticals. And that, definitely drives up the prices of the plans that Tiara is talking about. And even when you do get on a good plan, the deductibles can be so high that it's still impossible for people to actually get the care that they need. And so I think knowing that a healthy workforce is a productive workforce, and knowing that small businesses employ, the majority of people in the United States, that they need to focus on kind of helping support small businesses like us and like Tiara's to help get the benefits to their employers that they need in order to be able to sustain them and their families.
Tiara, what would you add to close us out?
Yeah, of course. I would agree with everything that Dr. Gonzalez just said. And I would add that the federal government can help us in working on ways to cut the consumer costs, to make it easier for us businesses to offer benefit packages like healthcare and things like that, childcare, paid family leave, medical leave, so that it can make it easier for, as Dr. Gonzalez said, a healthy workforce will help all of us. It'll help drive the small businesses' productivity and help the economy rise, help the overall economy of the country.
I want to thank you both so much for joining us today, putting on a hat when you have so many hats back in your day jobs. It's been an honor to be on the panel with you. I'm handing it back to Tammy.
Wow, wow, wow. Thank you, Amy, for facilitating that conversation, and a special thanks to Tiara Flynn of Some New Marketing and Dr. Erica Gonzalez of STAMP, South Texas Allergy and Asthma, for joining us and for sharing your raw and honest and actual experiences as employers. We are now going to turn to an incredible group of experts and advocates to talk about what policymakers, the market, and other stakeholders should do in response to the survey findings and to their work. It is now my great privilege to welcome Kim Brown, a visionary and leader in the space, who by title is the Senior Program Officer in the Economic Opportunity and Mobility Program at the Bill and Melinda Gates Foundation, who will lead this conversation. Kim is a force of nature, and her commitment to economic mobility runs deep. We could not have a better voice to guide us through this conversation. Kim, thank you for being here and welcome.
Thank you, Tammy, and good afternoon to everybody. Thank you all for joining us today for this important conversation. As Tammy said, my name is Kimberly Brown, and I work on the economic mobility and opportunity strategy at the Gates Foundation. And a significant part of our work is focused on job quality and engaging small and medium-sized businesses. So I'm really excited about today's conversation, where we're all going to learn a little bit more about the supports and investments that are needed from the private, public, and philanthropic sector to really increase the likelihood that small employers are the source of good jobs. And so today I'm really thrilled to announce that we have Dawn Baylor, the Managing Director and Co-Head of Community Impact at Lafayette Square, Rodney Foxworth, who is the President and CEO of Common Future, Jorge Gonzalez Hermoso, who is a Research Associate at the Urban Institute, and finally, Ida Rademacher, who's the Vice President and Executive Director of the Financial Security Program at the Aspen Institute. So let's just get right into it. We learned from some Gallup work that more than 2/3 of low-wage workers in the United States work for a company that employs fewer than 100 people, and that nearly half work for companies that employ fewer than 20. Their analysis also found that these workers are also more likely to be Black or Latino. So Jorge, if you can kick us off, can you help us put this into context by telling us a little bit more about these businesses?
Sure. Thank you, Kim. Yes, so this data from Gallup and also the survey that was just presented, it does align with some of the evidence that we've seen on our side from our research, specifically from the Small Business Administration and the Census Bureau does every year an annual business survey. From this data source that we've analyzed, we know there's a correlation between the size of the firms and the average payroll value per employee. So basically the average salary paid to the workers in those firms. So just for example, firms with less than 20 employees pay on average a $40,000 payroll per employee annually. Whereas firms with more than 100 employees will pay on average about roughly $60,000 a year. So there's a significant difference there. And we see this correlation between the size of the businesses and the race and ethnicity of the owners. Now, I think it's important to remember that fewer firms, either big or small, are owned by people of color. Just to illustrate this, non-Hispanic whites make up 64% of the adult population, but they own 81% of all the firms in the US. And just to give you some more data on just the relationship between size and the race and ethnicity of owners. So only 1% of the firms owned by Black people or Latinos or Latinas have more than 100 employees. Virtually 0% of the firms owned by Asian people have more than 100 employees. For white-owned firms, 14% of those firms have more than 100 employees. So we see a significant difference between the makeup in terms of size of the firms based on the race and ethnicity of those owners. So we have this correlation between the employment size, the race and ethnicity of owners, and also the payroll average value. And we see that also in this data. The average payroll per employee at firms that are owned by people of color are significantly less than those owned by white people. So again, this is confirming, validating what has been found through these other sources. And I think it's also, I will close just saying, I think it's important to remember that there is a network effect, whereas small businesses, which are often going to be owned by people of color, will be more likely to hire from within their own communities and their own social networks, even from their own families, as was the example of that Tiara was sharing from her own family and business. So there's a network effect where the people who get hired by these companies, when they're very small, when they're owned by people of color, may look, the workforce may look similar, very similar to that of the owners. So I'm gonna stop there. Hope that set a picture.
Yeah, Jorge, thank you for setting the stage. And Don, I'll turn it over to you. Your work focuses primarily on larger small firms or that middle market. How would you characterize these businesses and the challenges that they might face in creating good jobs?
Yeah, no, thank you for that. So I think there are a few similarities that were really kind of mentioned, I think, in earlier parts of the conversation. You know, one is around capacity. We do see a lot of doubling up of the HR function, even in the middle market. We talk about the middle market. For us, that's really, you know, about $8 million in adjusted annual revenue, up to about $50 million in adjusted annual revenue, with firm sizes in terms of employees ranging from, I would say, 75 all the way up to 500 and a little bit above. We also see competition being a big issue, both for talent, but also just generally in the marketplace for market share. And one thing that we also see is differential access to benefits. You have a lot of workforces. When you start to expand the number of employees, you will have maybe 40% of the employees that are LMI, for example, and 60% that are middle and upper income. And even though these employers are offered the same health plan, they're offered the same retirement plan, it's probably no surprise that given their differences in income as well as wealth, that we see much lower take-up on health plan benefits as well as retirement plans. And so that's one of the things that we really focus on at Worker Solutions at Lafayette Square within our portfolio companies, is to really provide them incentives and also tools and consultation to improve uptake for these critical benefits, because what you'll see is about 25% of LMI folks will participate in the healthcare plan compared to 70% of their non-LMI colleagues. So there's really big gaps when it comes to actually benefiting from these benefits that are in the workplace.
Great, thank you. Rodney or Ida, do you want to add anything here?
Well, I'll add something, Kim, and thanks for all the comments before me sharing, because everything that's been shared already, I'm in full agreement with. And I just want to really stress what Jorge began with as well, in terms of just the disproportionate nature of what it looks like for a Black or POC owned business in terms of employment. And so, and both on the employment side, but also disproportionately how they're impacted adversely from economic conditions more generally. So we're in a place right now where there's a lot of talk of recession. Obviously, we're in a highly inflationary environment right now, and that's disproportionately impacting POC-owned businesses that were already hard hit more generally. And so, just to contextualize it even more, 4.2% of Black-owned businesses have employees compared to nearly 21% of white-owned businesses, right? So just even beginning there, recognizing that even for Black-owned businesses and Latino-owned businesses throughout the majority of neighborhoods throughout the U.S., there's significant precarity in terms of their own economic capabilities, in terms of how much cash reserves they might have. For example, there's a JP Morgan Chase Institute study that showed that at least 90% of majority Black and majority Latino or Hispanic neighborhoods, there was a majority of small businesses with cash reserves of less than 3 weeks compared to just over a third of majority white neighborhoods. And so just, again, contextualizing for everyone that the depths of these inequities are quite significant. They're not, small in nature, that they're outstanding. And so anytime we're having a conversation about small business and entrepreneurship, we're really making sure that we're having a real clarity around what that means for small businesses that are owned by people of color.
Thank you. And Rodney, I want to make sure everybody can hear your wonderful ideas. You're a little bit quiet for me. I'm not sure if other people are experiencing that. So maybe as we go through this, you can pump up the volume just a little bit. The survey released today that people have been talking about showed that small business owners and their workers are typically in the same financial boat. It also showed that business performance is a critical driver of the financial health of people employed by firms with fewer than 100 employees. We know that workers in profitable small businesses are much more likely to have strong financial health compared to their peers who work in firms that are not profitable. For Black-owned firms, financial health of workers improves by about 29% when the firm is profitable, and for Latino-owned firms, the spread is about 26%. So I think Ida, Rodney, or Jorge could take this one. Maybe we'll start with you, Ida, since you haven't spoken yet. I think you can all weigh in though. If the firm performance is a significant driver of the financial health of workers, what should be done to strengthen the financial performance of these small firms?
Yeah, thanks so much, Kim. And thanks also to the co-lead sponsors on this webinar today. It's just a great set of knowledge, starting with Erica and Talia. I guess I want to point out the feedback loop that we're talking about here. So small firm financial stability, worker financial stability, the ways that that correlation's happening in the data that you're seeing here is not coincidental. And oftentimes at the smallest business levels, the household balance sheet is the business balance sheet in a lot of different ways. When people get their start, when people figure that out. So at the financial security program, I want to answer your call. I think it does matter, Kim, and others can talk to this even more than me, around what is the financing, what is the access to credit, what is the access to equity for the small business. But I also think a lot of the times, for at least for the financial security program, we tend to start at the household level, and whether that household's head of household is a small business owner or a worker, the same three conditions are true for a household about what it takes to reach financial security. So in our work, that financial security framework has 3 pillars. The first is the household experiences routinely positive cash flow. Now that can either be from the wages or the business profits that are coming into that household. It can also be from non-labor kinds of income. But the main thing is that month to month, and even Todd talked about income volatility, month to month, week to week, year to year, people can meet their basic obligations and have some residual amount that's there for pillar number 2, which is to build savings and personal resources. We know all the statistics about what percentage of households in the US, almost 50% still, can't find $400 in the face of an emergency. So number 2 pillar for us is personal resources, those savings and financial cushions that allow people to weather small shocks and invest in their family well-being and in economic mobility. That's really where that correlation to mobility comes from. The third piece, though, and you mentioned it at the beginning, and I think that's where we're going to go with some of the conversation, is the access to utilization of and benefit from access to public and private benefits. So those are employer-provided benefits, those are public benefits, and those are personal benefits that someone may choose to buy. And that is one of the biggest differentiators when it comes to some of the occupational segregation that we see in a lot of the data. Many other researchers have referred to those benefits as a wealth escalator. Janet Bogasla, I think, coined that term at Brandeis, which means, and what we've done in our Benefits 21 initiative is started to get a little bit agnostic about where does the benefit come from, but really understand what is the function of that benefit. We can't expect households or small businesses to self-insure for every giant shock.
Did we lose Ida? Can folks hear me?
Yeah, I believe that she's probably in an internet unstable environment out there in Aspen, Colorado.
I think we lost Ida, so hopefully she'll be able to catch back up with us. I'll go to you, Dawn. Thankfully, not all small employers are underperforming financially, but the workers still might be struggling with their financial health, and the components of a good job could still be stronger. So what sorts of incentives and other interventions do you think can contribute to making good jobs for that segment of larger and financially strong small employers?
Yeah, I'm glad you asked that question, because it's really at the heart of what we do. We really see worker financial well-being as a critical issue that must be addressed with our portfolio companies. Our first 2 portfolio companies, management reported to us that frontline workers were routinely approaching for salary advances on their paycheck. They had simply run out of budget room before that next paycheck. And so we have, to that end, we understand that most of the benefits that are provided in the middle market are geared towards middle-class individuals, and that there's a real need to bring in other benefits that really center the needs of low and moderate income workers, like having access to a 0% small dollar loan program, like being able to build credit by paying your rent through your employer, like being able to co-repay student loans as well. So I think there's a lot of other benefits that we have gone and curated that we match make with our companies, depending on the data and depending on what they see and what workers really see as their pressing needs. And so we're really just beginning to gather that data now. One of the things our first portfolio company did match up with one of our providers that provides small dollar loans, and we're starting to see rent being a reason for taking out a loan, which is actually kind of a new reason that, you know, I think kind of speaks to some of the economic realities that are occurring around the country.
Great, thank you. And Ida, I see you made it back. Do you want to try to finish that last thought? It's kind of hard to remember where you were. We heard most of it if you wanted to finish up.
I think it's fine. I think we'll get into the conversation. I just think increasingly as a country, putting benefits on the table, just the fact that, you know, so retirement is one example, and Dawn talked a lot about it from who takes advantage of it. The reality is 45 million people, the majority of people who don't have access to retirement savings work in small companies. That's not because those small businesses don't want to provide that benefit, but it's a much higher cost proposition for a small company, and they are in big chunks of dollars in terms of outlay. And so when you're already working on those lean margins that we heard about earlier, it's really hard to make those choices. And we think that in addition to workers and workers wanting to work for companies that they feel seen and heard in, and those companies wanting to do right by their workers, we have to make it easier. We have to drive the costs of benefits acquisition, benefits access down. We have to make it easier for people to access it. And to Don's last point, the fact that it's not just that wages aren't competitive, because a lot of places that's where people focus first, making sure those wages are competitive. But the rising costs of healthcare, housing, and dependent care are really stripping out any of the benefits that happen in that space from a rising wage. And there's just other ways that we need to think about the systems that can drive those costs down, so that we find ways for that quality of job and the quality of that worker and businesses experience to be helpful in making a dynamic economy work better for everybody.
Great, thanks, Ida. Let's stay on the benefits topic. So obviously, as you mentioned, benefits are a critical dimension of the financial health and financial stability for workers. And you talked about health insurance, the retirement savings, and other forms of support. And obviously, you mentioned that the small employers really have a bigger challenge in being able to offer some of these more generous benefits packages. So in the survey that we saw today, small employers told us that they see benefits as critical incentives for workers and really the right thing to do, but it could be cost prohibitive for some. So I'll just stick with you, Ida, and on your team and with the work with the Benefits 21 team, you're deeply focused on this challenge. And what do you see that's on the horizon that gives you any confidence that the provision of health benefits can actually be addressed?
Well, I want to recognize one of the questions that somebody brought up that I think is part of what contextualizes my answer to you, Kim, which is small businesses are the engines for real job creation. They are just the first place where hiring. You see the number of small businesses that started back up after COVID exploded. They're also a place that jobs get shed first. So what's happened? Let's just appreciate that what's happened in the labor market over time is that benefits historically came up as a incentive and a competitive advantage maker post World War II, when wages were constrained. And it's really an American anomaly that all of the benefits that we provide are both at the discretion of the employer, and that the employer is the fiduciary in the middle of that decision-making process. When we think about small companies making it, when we think about the best quality jobs, if you've got a worker who's cycling in and out of multiple jobs in the course of several years, the idea of tying all of your benefits to one employer doesn't really produce that routinely positive cash flow. So part of the innovation comes from how well public benefits and private benefits talk to each other, how compatible they are. So when you think about healthcare, it's not just about what are the innovations that can drive down the cost of healthcare and potentially even supplemental insurance, because if you've got a $3,000 or $5,000 deductible, that low wage worker is going to have a hard time, just as hard a time with that financial shock as they are with an overall medical bill. So a lot of times there's a secondary insurance product, but also if they leave that job, how quickly can they get connected to unemployment insurance? How quickly are they connected to a Medicaid or a Medicare provision? The interoperability and portability of benefits, and the questioning of whether or not in the future, all of these benefits should revolve around the employer, or we should really tap into the payroll provision function to make sure that we're pooling large amounts of workers to be able to access the benefits they need for financial security. So I think that's a provocative statement to make. It doesn't fly in the face of job quality, but it really does try to bring into the conversation the recognition that the outcomes for workers and the outcomes for small businesses are quite aligned and tied together, and we need to co-solve for these problems.
Great, thank you, Ida. I'll go back to you, Don. Quickly, what challenges do you see across the businesses at Lafayette Square? And what kind of solutions do you see for some of the benefits challenges?
So, one thing, around, I'm glad we're spending a good amount of time talking about health insurance and healthcare, because it is, a critical issue for employers as well as workers. One of the things we also promote, in addition to third-party impact solution providers, is HR policy changes. So you can actually change your retirement plan to not hinge an employer contribution on an employee contribution. So a non-elective approach. You can also have a sliding scale for healthcare premiums that comports or aligns with federal affordability rules, so that you don't have this mismatch in terms of the share of income that employees are paying for their health insurance. This is one of the reasons why we see such low take-up for health insurance, even when it is offered. Those are some of the things that we're also looking at. We're also looking at supports for working parents with kids in the K-12 system. That is one big issue that has emerged out of this pandemic, as low and moderate income workers, particularly those of color, who are really struggling in a post-pandemic school system. We're starting to see lots of outcomes that are looking more like 1995 than where we are now. So there's quite a few solutions that speak to different populations that we are continuing to source, but having that partner with the employer to really work through some of the best things. We're also beginning to measure financial health on board a company. So we're actually measuring employee financial health and really targeting solutions to improve that over the tenure with our company.
Thanks. Let me get Jorge and Rodney back in. Jorge, the efforts are underway across the federal government, including the Departments of Commerce, Labor, and the SBA, to improve job quality. Do you have any recommendations that you'd like to share that would help our federal policymakers or lawmakers make some good decisions?
Sure, and I will focus on going back to this point that the profitability, the prosperity of the business itself is critical, so that they can then in turn provide those quality jobs. So focusing on that, Todd talked about access to capital, and Secretary Chang talked about technical assistance. I think these are key. I would add to that networks. Networks are very important. Networks of suppliers, of potential customers. Access to resources are often shared through networks. But focusing on access to capital and technical assistance, I think there are some things that could be done. I think it would be important to expand access to capital through increased funding to community development financial institutions. For those who don't know, the CDFIs, they focus on underserved, providing capital to underserved communities and underserved businesses. Even piloting programs like a first loss reserve pool for CDFI, small business lending. Increasing the focus within the Small Business Administration on loans that go to early stage companies, women-owned, minority-owned, veteran-owned businesses, those that might require that extra help to level the playing field. More flexibility with the SBA flagship loan programs, the 7A, the 504 loan programs, for example, by allowing for revenue-based financing, because the smaller businesses that may not have those credit scores, those collaterals, we need alternatives for them to be able to prove their credit and access key capital. We also need to look at not only debt capital, but also equity capital, pay more attention to that. So it will be important to look at, I think there are some opportunities there to improve some of the EDA programs in the small business investment company when it comes to equity capital. Also, we could create incentives for banks to buy CDFI loans that perform at appropriate levels, and that would bring more capital for the CDFI so that they can continue providing loans to small businesses. This could be perhaps done through the Community Reinvestment Act. On technical assistance, Secretary Chang talked about meeting folks where they are, and I think this is very important, especially with the small business development centers that are coordinated by the SBA. We've also found in our program that technical assistance programs are most effective when they're paired with grants, even with very small grants. So there are opportunities there to expand those type of opportunities. This perhaps is not, might be more focused on entrepreneurs to turn them into business owners so that then they can provide those quality jobs, but relaxing occupational licensing is something that could be very important, just to lower those barriers of entry for many entrepreneurs. And finally, because I'm a researcher, I will always advocate for better data. So better administrative data and surveys, for example, asking about job benefits in the annual business survey, or more granularity in the Bureau of Labor Statistics benefits survey. So just to provide some examples of things that could be done.
Great, thank you. And let me end it with Rodney. This can't be an issue that government is going to be able to address all on its own. Both small employers and large corporations benefit from strong communities and financially healthy workers who are consumers in those communities. So what would you recommend to leaders in philanthropy and the private sector who are listening today?
Thanks for the question, Kim. So just to be clear, the government still has a really active role here, though, because one thing I will point out, given what everything that Jorge named, incredibly important, we have to also interrogate just the opportunities that government resources have actually disproportionately impacted communities of color as it pertains to barriers for entry of small business ownership. Think back to the early onset of the pandemic and what happened with the Paycheck Protection Program, how that initially did not get into communities of color. That was based on government funding and sort of historic context. I would also consider the fact that government has a huge role in terms of these minority benefit agreements that actually are rarely enforced at the local and state level. So there's real opportunity there for government to be able to play a leading role there. Again, not every small business is going to have Lafayette Square in its corner to be able to advocate and build these sort of structures in place. The thing that I would name in terms of the private sector, here's a real opportunity to really evaluate your supply chain and what businesses that you're working with and prioritizing and investing in directly to small businesses, and really in really specific categories. The great thing about this conversation today was that we're talking about micro enterprises, we're also talking about middle market businesses. So being really clear about, as a private sector entity, a large private sector entity, when you're actually engaging with and partnering with small businesses, being clear about where you are on the continuum of where the business is, because they need different types of supports.
Thanks so much for that. And thanks to everybody, great panelists. And I'm going to turn it back to Rhett.
Actually, you get the short stick, you get Tammy.
Oh, sorry, Tammy.
It's all good. As we hoped, this was a rich and informative conversation. All I can say is wow. Please join me in thanking from the top Deputy Assistant Secretary of EDA, Michelle Chang, our extraordinary moderators, Amy Saxton and Kim Brown, our incredible business owners, Tiara Flynn of Some New Marketing and Dr. Erica Gonzalez, and of course our thoughtful and dynamic panelists, Don Baylor from Lafayette Square, Rodney Foxworth from Common Future, Jorge Gonzalez Hermoso from the Urban Institute, and Ida Rademacher from the Aspen Institute. This event would not have been possible without the extraordinary collaboration with WorkRise and Common Future, and so we thank you again and often. And a special thanks to everyone who attended. Taking an hour and a half out of your afternoon is not an easy thing to do. We hope you enjoyed. We hope you found it valuable. A recording of the session will be shared afterwards, and we will post it on the reimaginemainstreet.org website. And with that, our gratitude, the event is now concluded.